is Dr. Adarsh, clinical oncologist from HCG Cancer Center, Nairobi. Today is Testicular Cancer Awareness Month, which is April. So testicular cancers are the cancers which arising from the testicles, which are the one of the male reproductive organs. So these tumors are rare; they are not common. So annual incidence is less than 1%. But these are the most common solid cancers in male in the age group of 20 to 35 years. One good thing about this testicular cancer is it has very good survival, which is around 95%. They're curable. So now, when it comes to testicular cancer, so we classify them into germ cell tumors and non-germ cell tumors. And in that, germ cell tumors are the most common. 95% of the tumors are germ cell tumors. In that, we have again we classify them to seminoma and non-seminoma. So most common the risk factor for the testicular cancers is the crypt organism, that is undescended testis. So it is one of the main causes, and also the other risk factors include family and personal history of testicular cancer, as well as the other genetic syndromes like Klinefelter syndrome, Down syndrome, and other causes of male infertility. So the presentation of these testicular cancers, most of them they present with scrotal swelling, heaviness in the testis, which may be associated with a dull aching pain. Some patients may also present with enlarged breast, that is gynecomastia. So most commonly these patients are evaluated for infection of the testicles. So the investigations we use to evaluate these tumors are like ultrasound of the scrotum, which detects the mass in the testicles. We also once the mass is detected, we also do a CT scan for the chest and abdomen for the staging, and also the blood test, which is where we check number of tumor markers like alpha fetoprotein, beta HCG, and LDH. So the biopsy is not done. The one of the treatment as well as diagnostic is a surgical procedure called radical inguinal archidectomy, where the testicles are removed along with a part of the spermatic cord. So where on the histology it will be diagnosed whether it is a seminoma tumor or non-seminoma. So most seminomas are the most common tumors, like particularly the germ cell tumors are the most common tumors. So in that, again, we classify them to seminoma and non-seminoma. The further management of testicular cancers is depends on the staging of the cancer, which is assisted by the CT scans. It's a PET CT scan, which scans the whole body. So normally the staging of the testicular cancer depends on the surgical procedure, the radical archidectomy. It also depends on whether the lymph nodes are there in the abdomen, or whether if it is the tumor which is limited to the testicle, it is a stage 1 tumor. The tumor which is limited to the testis as well as the involvement of lymph nodes below the diaphragm is stage 2. And if it is involvement of lymph nodes above the diaphragm along with the testicular mass, is stage 3. And if it is involving non-lymphatic organs like lung and other tissues, it is a stage 4 disease. So the management not only depends on the stage, it also depends on the histology, that is whether it's a seminous tumors or non-seminous tumors, as well as the tumor marker levels, and as well as the staging. Apart from the surgery, we use chemotherapy as well as radiation, depending on the stage. Okay, stage 1 tumors, again, it is seminous tumors. They are handled by surgery. If it is a high risk, we do either chemotherapy, one cycle of chemotherapy, or we also give 2 weeks of radiation. Similarly, non-seminous tumors are managed with the chemotherapy. So stage 2 tumors, again we combine chemotherapy as well as radiation. Early stage 2A tumors, the tumors which are involving the lymph node less than 2 centimeter. And most of the other stage 2 and stage 3 tumors we manage, and as well as stage 4 we manage with the chemotherapy. That is for either 4 cycles of 3 or 4 cycles of chemotherapy. These tumors are highly chemo sensitive, they respond well to the chemo. So normally once I told the cure rate is around 95%. The chances of recurrence, again, if the tumor recurs, we do chemotherapy, the salvage chemotherapy with some other chemotherapy regimen. So where the tumor will be taken care. So overall, these testicular tumors, these are not so common tumors. They are rare tumors, less than 1%, but with very good therapeutic outcome, that is 95% cure rate. So as well as survival. So yeah, to conclude, testicular tumors, these are rare tumors. So the surgery, chemotherapy and radiation treatment, these are the main modalities of treatment. So these are most common in young people less than 40 years. The outcome is good. They have 95% cure rate.